Hello and welcome to the Inquire podcast. Here we chat all about additional support for learning in Scotland with experts from across the sector. We hope that will really help our listeners, so that's parents and carers and also professionals, to understand a bit more about children's rights to support at school and also in the early years. So my name's Ellen. I'm an information and advice officer at Inquire. Salena, do you want to introduce yourself?
Thanks, Ellen. I'm Salena Begley. I'm Partner Engagement Manager with the charity Family Fund. We provide grants and support to families raising disabled and seriously ill children and young people on a low income.
Wow, that's really interesting. So yeah, to start off, I thought it'd be kind of interesting to hear a bit more about what the Family Fund does, what families they support and how you support these families.
Sure. So Family Fund's the UK's largest charity providing grants to families raising disabled and seriously ill children and young people on a low income. We've been around for over 50 years. We came about through a public campaign to see families whose children had been affected by the drug thalidomide better supported and supported with those additional costs. So that was over 50 years ago, and our first grant provided support for a father to be able to go along with his wife and daughter so that when she was getting surgery at Great Ormond Street and they travelled from Wales, and we gave a £26 grant. So that was the first sort of example, I think, of where our support as a third sector organisation complemented the support that's available through entitlements, because there was a recognition then that health is more than just medical support. It's also about your overall well-being, but the entitlement didn't extend to the father being able to go. So that's where we stepped in, and I think that's been our model really since then, providing that complementary support. We now deliver a range of different grant programmes across the UK, including a number of grant programmes that support families here in Scotland. And we provide grants that are really wide-ranging, that support the health and well-being of children and young people and their parent carers, from very practical support like help to get a new kitchen appliance to things like family breaks, digital devices, sensory toys and equipment, day trips. It really is, our support really is quite wide-ranging and very much depends on what the funder wants to achieve through providing that support, and wherever we can, we provide flexibility so that families are in charge of what they're asking for and what they receive.
Wow, that sounds really amazing. It sounds like you provide so many really important things. Having a disabled or a seriously unwell child could obviously affect a family in lots of different ways, but why can it make finances especially difficult, or how can it impact on a family's finances?
So it's quite complex. I've worked for Family Fund almost 15 years, and prior to that worked in social services, supporting families of disabled children and young people. And not one family is the same. Families of disabled children are not, they're not a uniform group. Each family has different factors that interplay to impact on both their financial well-being and their overall health and well-being. But there are some key issues that families of disabled children and young people face in relation to financial well-being. So there's the ability to bring in income through paid work is more often than not severely constrained. A significant proportion of the families we support cannot work because of their caring responsibilities. And there's another proportion who continue to work but may have to take lower number of hours, less well-paid jobs, may not be able to progress in employment as they would wish, may not be able to take up educational opportunities as they would wish because of their caring responsibilities, and because, I'll talk about some of those other factors later, but so there's the ability to bring in income, there's the adequacy of social security benefits that are there to support families who perhaps need to rely on social security benefits because they can't bring in adequate income through paid work. So there's the ability to bring in income through paid work. There's the the adequacy of social security benefits to support families. And then there are also the additional costs that families with disabled children and young people incur. And those are significant. They range from having to replace items more often because of wear and tear. So if you've got a child with a physical condition, health condition, it means you need to wash their clothes more often. Or if you've got a child with sensory sensibilities or sensitivities rather, that needs to change their clothes more often, you're going to have your washing machine on more often. You're going to have to, maybe if you live in Scotland, use a tumble dryer to get things dry quickly enough. You're going to have to replace items more often. Things get broken more easily. So families need to replace items more often. They quite often need to purchase quite bespoke or specialist items which come at a higher cost. And there are things like energy costs that tend to be higher. There's been quite a lot of media coverage of in terms of energy, but there are a lot of costs that maybe people wouldn't think about. So families of disabled children and young people quite often use more energy because if you've got a child perhaps with a visual impairment, for example, or a child who needs care during the night, you're going to have the lights on more often. If you have a child that requires medical equipment that uses energy or requires the use of digital devices for communication, you're going to use more energy. You rely on those items. You don't have the choice of whether or not to use them. So these are unavoidable additional costs related to disability. There's also things like transport. If a child has a suppressed immune system, they're not going to be able to get on the local bus, potentially. If you have a child with sensory sensitivities, they may not be able to get on public transport, maybe too distressing for them to be in an environment like that. They might manage it some days, they might not manage it other days, and that may then mean paying for taxis or having to use a car if you have one. So there are additional costs around about transport, additional costs around about replacing clothing more often, having to purchase specific foods is quite often an issue as well. Children may have a restricted diet because of dietary needs, or they may have a restricted diet because of sensory sensitivities. So these are the issues that families that we support tell us about through our research, and these are hidden costs that other people don't have to think about, you know, and so that additional costs, which research by Scope has shown that families with a disabled member of the household incur it's over £1,000 a month in additional costs. It's significant, and even, as I said earlier, even with disability benefits support or social security benefits, they don't go far enough to meet those additional costs. One of the other costs that we've seen families incur is around about paying for therapies privately. There's a huge price tag attached to that. I recently spoke to a parent who wouldn't necessarily be considered to be on a low income, but was incurring a significant cost every month to support their child to access private counselling. They had a physical impairment which was having an effect on their mental health as well, and so that parent doesn't have a choice around about that. They want to ensure that their child's well-being is taken care of. And then there are specialist items, and they can be really costly. There was a quote from a parent that took part in one of our research surveys, and he said, you know, something like, you know, when the word disability is on it or specialist is on it, the price just goes up and up and up, you know. So sometimes the costs are phenomenal. I've worked in this field for so long, and sometimes I'm still taken aback. And with families of disabled children, despite the fact I've worked in this field for so long, every time I meet a family and I hear their different story, their specific circumstances, it makes me think about things that I've never had to think about before. So I know that was a rather long answer to a short question, but it is really complex. But the key issues are the inability to bring in income through paid employment, the adequacy of social security benefits, and the significant unavoidable additional costs related to disability.
And I know recently you brought out a report, The Cost of Caring, that kind of went into these issues in a bit more detail. Can you tell us a little bit about that report and what I guess you hope maybe to achieve by getting this information out there?
Yeah, so we've been undertaking research with families for some years, but particularly from the time of the COVID-19 pandemic. During that time, we undertook research to track and to be able to record the impact on families of disabled children and young people.
Yeah.
And since then, we've continued to undertake research. So we brought out a previous cost of caring report, 2022, which it used the research that we'd done during COVID and after to sort of look at what the additional costs families were facing, what they were, and what impact that was having on health and well-being.
Yeah.
And I think that's the key thing is the relationship between financial well-being and financial security and health and well-being, which can't really be underestimated. So what we hope to achieve by that is being able to show what the specific issues are that face families raising disabled children and young people, and to support policymakers to inform their decision making around about policies that they develop that impact on families raising disabled children and young people, to inform their work. There's already a lot of research out there. I think what we have in terms of our research is we know that the people that are undertaking the survey and feeding into the research are families raising disabled and seriously ill children and young people on a low income, and we know that's who's completing the research. So it's their voice. What we hope to achieve is to provide an opportunity for families raising disabled children and young people across the UK to tell policymakers what their lives are like, what the challenges they face are in terms of cost, and to inform the work of policy and decision makers so that they can actually take action to support families. Families are looking to be, and they have a right to be supported in their caring role. But despite their best efforts, they do often need policymakers to actually take those decisions that are going to actually make a difference day to day.
I'm kind of thinking a little bit now about the impact on like learning and school specifically. What kind of impact do you think that, you know, having all this going on at home and maybe having financial worries at home can have on a child's learning at school or their experience at school, or a young person's kind of time at school?
I think there's a real interplay between school life and parent care's experiences and issues around financial well-being. So in the cost of caring report and in previous research, what families have told us is that where a child's school placement is not stable, or where they're called upon regularly to actually step in during the school day and provide assistance or pick up their child or come and support their child because their child's distressed, for example, that really has an impact on the family's ability to undertake paid employment. So that's something that's come through in our recent cost of caring research, but in previous research, and it's also been evidenced in other research such as by Enable Scotland. Chloe Blackwell undertook some research around about the interplay between autism and education and families' ability to undertake paid employment. So there's a real interplay in terms of the stability of a school placement and the ability of a school to meet a child's additional support needs, and a parent carer's ability to have a life alongside caring, which may include paid employment. Many parents feel that they even when the child's at school, they have to be available, that the phone might go at any point and they might have to be at the school. So there's an impact on the parent carer. There's also the impact of financial worries on children and young people. So we know that where a family has financial worries, that can affect mental health, the mental health of the parent carer, and that will have an impact also on children's health and well-being. Debt's a big issue amongst families that we support. There's a especially in the back of the pandemic. Many families during the pandemic used up their savings. I think in our recent cost of caring research, there was something like 80% of families who responded in Scotland didn't have any savings or investments. So they don't have anything to fall back on. So if an unexpected cost comes up, so if the washing machine breaks down, that will cause additional stress because the family don't have savings to fall back on so that they can easily replace that item. Anybody who really relies on their washing machine knows how stressful that is. If you're a family that doesn't have the backup of savings or can easily access affordable credit, that's going to cause stress, and stress affects everybody in the family. Trying to keep clothes clean, clothing children for school. If you're a parent carer and you don't have access to a washing machine or be able to dry clothes easily, then before the school day even starts, there's stress. So that's where, having that financial support available for families in that position is really important. And that's also why it's important that we support families with things like debt, so that that we're supporting families to avoid incurring debt in the first place, but also that there's easily accessible, non-stigmatising debt support. I think when we're thinking about the interplay between additional support needs and low income poverty and the impact on children and young people, we also have to think about the siblings within the family. So if you're on a low income or experiencing poverty, you're going to have less choices in every area of your life, really, including things like housing, including things like access to social and leisure opportunities, which are so important for health and well-being, so important for children and young people's development. And it can be difficult for children and young people where they feel that their peers are able to have opportunities, have items that they don't have access to because their family doesn't have the financial ability to provide those for them. And again, that's where support organisations and education schools can support with providing those opportunities for development out with school. So we know that siblings, experience have a different experience quite often, where they have a disabled child, have a disabled sibling rather. For example, if a family's housing opportunities are limited, which many families' housing choices are limited at the moment, if you're having to share a bedroom with your sibling who has additional support needs, your sleep may be affected, your ability to have space where you can learn, you can do your home learning work may be affected, and the opportunities to have friends back home might be affected, as well as things like not having the opportunity maybe to go places and do the things because your parents or your parent has to prioritise your siblings' needs. So there's it's complex. I think where finances are restricted, parent carers, from our research and from my experience, wherever possible, they will prioritise their children's health and well-being over and above their own. Families have told us that they have to miss meals sometimes, they have to restrict their meals, they have to restrict their own, they reprioritise their own health and well-being because if there's limited finances, the priority for using them is to meet their children's health and well-being needs. So we see an impact there on families' health and well-being as well. So obviously, I think for in terms of the impact in school, as I say, where family finances are severely restricted rather, that does affect families' ability to access things like, if there's a school trip and it comes at a significant cost, which they sometimes do, then children may miss out on those opportunities that other children are having. And again, that's where having additional support from third sector organisations or where the school might be able to access funds to support with that. I think it's really important that those opportunities are accessed for young people. if they want them.
Yeah. And I think as well in our work at Inquire, we, when we're explaining additional support for learning in school, sometimes it's much broader than sometimes people are aware of. That, if a child or a young person is experiencing poverty, or there's things going on at home, or if one of their siblings has a disability, then all of these are considered additional support needs, and they have the right to support in school with those things. Do you have any tips for professionals who maybe think that a family might be struggling with finances, of how to approach those conversations, or what support and what things they can put in place to help the family feel supported?
Certainly in my time at Family Fund, I've seen some schools where they've employed really good models to try and ensure that families have got easy access to information and support in a non-stigmatising way. So things like providing opportunities for families to come together and then they can share information with one another. I've certainly seen it where one parent will say, oh, you should apply to Family Fund. I applied to Family Fund and they provided me with X, Y and Z, and it really helped us. And I think for families to hear from other families that they've accessed support breaks down barriers. I think also models where it's parents' night and they have information and support there available, so parents can just pick it up on the way past or stop and chat if there's somebody from the organisation there. Again, really helpful. Some schools are really proactive about that. I recognise the extreme pressure that schools are under. I don't think that teachers should be expected to be welfare benefits experts or advice experts. I think the key thing is that the school have the ability to signpost and make that information as easily accessible as possible. Signposting to organisations like Family Fund, where we have information support resources available on our website. Families can go in, they can do things without it having to speak to somebody initially, fill in a debt support tool or do a welfare benefits check. We have online courses that families can do in their own time to learn how to find, where they can get that information support that they need. So I think the key thing is relationship though. And I think where a family feel that there's a trusted relationship, they're much more likely to be able to broach that. But I think taking the burden off families to come forward and actually making information and support easily accessible, destigmatising being on a low income. Families face multiple types of discrimination day in and day out. And I think where we can provide information support in a non-stigmatising way, that means that they know where to go to get information support around about financial wellbeing does help. We've had, certainly had some really good feedback from families about having that information support easily available, but also I think where parents can come together and share their own experiences, it means that families don't feel that they're alone. And I think that's the key thing is letting families know that actually if you are struggling, there is support there. There are trusted organisations that will help you. But families with children with additional support needs can be really time poor. So providing support through school where there's information support, signposting of organisations that can be trusted, I think that is a key way in which schools can help families by providing information support to families and giving opportunities for families also to come together to not necessarily that's the topic of conversation, but where you have that information available, it can really help.
We also know that finances and being on a low income can have a big impact on digital connectivity, families being able to access devices, and that can obviously have a big impact on education. Would you be able to talk a wee bit more about that and how that affects families?
Certainly. I think it's a really important point. We saw during the pandemic, we saw a change in what families were asking for. So families weren't able to access family breaks or breaks in the same way. Excuse me. And we saw a big uptick in the number of requests for digital devices. And I think that's when the world realised just how reliant we are on digital and being connected in order to access things like information around about financial wellbeing in order to apply for social security benefits, in order to do a grant search even. So digital is enormously important. It's important for families to be able to access information and support and advice, but also it's important for children and young people's learning and development. But also, and alongside that, you know, there's the need for families to have access to digital devices, but also to be able to afford to be connected for data, and also the need to have support around about confidence to use digital, and for their children and young people to be able to access online learning, or for them to access online learning safely. So it's an element of the work that we do at Family Fund. We have 3 workshops for parent carers of disabled children and young people. We have a rolling programme of digital workshops, and some of them are about things like staying safe online, but also things around about, we've got online courses on financial wellbeing, how to do a grant search, and also some fun ones for kids like coding and etc. So digital is enormously important, and where families are not supported to be digitally connected, they are likely to not be accessing all of the entitlements or discretionary support that's available to them. And I think it's something that schools can ask about when they're sitting down with a family to do regular reviews or planning meetings. I think it's something that should be part of the conversation ideally. Because if a child doesn't have access to safe access online at home, the support of their parent, and they need some support around about skills or kit or connectivity, then the school can hopefully signpost them to support, such as Family Fund or Independent Living Fund or whatever it might be, to access a digital device.
I wanted to say thank you so much for coming to speak with us today. It's been really great to find out about the work of the Family Fund, and I think all the information you shared with us will be really interesting for parents and carers, and also for professionals to understand about how finances can impact on families' lives and what support is out there for them. If people want to find out more about the Family Fund and your work, where can they find you?
So they can find us online if they're digitally connected, at www.familyfund.org.uk. So you can find us online on our website. But also if you're not online, although if you're watching this you probably are, we have our helpline team who can answer any questions that families have on 01904 550055. We have web chat and so on. We're also on Facebook and other social media platforms. So you can find us on our website, www.familyfund.org.uk. You can also find us on various social media platforms, and you can call our friendly helpline staff on 01904 550055.
Great. And if you want to find out more from Inquire, so if you have questions about additional support for learning at school, Salena spoke a little bit about, in particular, some families of disabled children are being called into the school quite often to pick their child up during the school day. If you're going through an experience like that, or you have other questions about support for learning at school, we have a lot of information on our website, which is inquire.org.uk. And we also have a helpline that you can call if you've got questions about your child's support at school. We also have a website for children and young people specifically, which is reach.scot. So if you've got a disabled child yourself, or if you're a professional in supporting disabled young people, you can also point them to our website. So thanks so much for coming. I hope everyone enjoyed the episode.
Thank you.